Leahy, another rock star here. MPH is the public health strategist with the Addiction Prevention, Treatment, and Recovery section of the Behavioral Health Division of OHA. It's a lot, Jude. Jude is an amazing presence in the Oregon public health policy programs and research endeavors. She has been instrumental in spearheading communicable disease prevention, harm reduction, overdose prevention, and peer-based interventions across Oregon. Jude works tirelessly to support the Crime Plus program and Saves Lives Oregon, among other social justice related work. And Jude, I told them this morning I was wearing the top that I wore when we had our first meeting and the HOPE study started. So I'm trying to get everybody up to speed and make sure that we all collaborate and create equally wonderful programs. So.
Okay, thanks. And I would note too, I remember at that time, Lauren, it was also a very dark time for viral hepatitis. And so I feel like that opportunity presented itself, and I am hopeful that there will be opportunities even in the times that we are right now. So I am, and I think you guys are actually looking at the second slide. So I'm here to talk for the next 15 minutes about Save Lives Oregon. And I'm hoping I will make it in that 15. So here we go. So Save Lives Oregon is a partnership between the Oregon Health Authority and leadership teams from organizations that have been active in harm reduction from across state and tribal communities in Oregon. The group was formed in 2020 during COVID-19, and as the opioid overdose rates began to soar during that time, as well as right at the beginning of when fentanyl started saturating Oregon's unregulated drug supply. So currently Save Lives Oregon we're actually over 400 community organizations, treatment providers, and public and tribal health agencies participate in the clearinghouse component and provide tools and resources and supplies that prevent and reverse overdoses, stop the spread of infectious disease, and reduce the risk of additional harms related to substance use. So while many of you are familiar with the Harm Reduction Clearinghouse, one of the key offerings of the initiative, Save Lives Oregon also provides more than supplies that reduce overdose infections and injuries related to substance use. Save Lives Oregon provides educational tools and materials to partnering organizations to share and distribute with supplies such as videos and handouts about how to recognize and respond to an opioid overdose with naloxone and rescue breathing, to fentanyl and xylazine test strip, instructional guides, and more. Save Lives Oregon also hosts monthly learning collaboratives for peers and practitioners on issues and topics that are identified by participating agencies through our annual survey. So on this slide, and you'll get copies of these, if you have a smartphone, you can use the phone to link directly out to that information. So while we don't have time to watch these short videos, I did want to share with you the links and invite you to visit the website, www.savelivesoregon.org or www.salvandovidasoregon.org, and check out these short videos. Each of them is less than 5 minutes and provides information in their own voices from people who are on and have been on our leadership team about why they do the work that they do with people using substances around the state. So I want to talk a little bit, just highlights of the impact that Save Lives Oregon has had. Since its start in 2020, the project has distributed over 724,000 doses of naloxone to partner agencies. We've had over, at this point, 20,000 opioid overdose reversals reported. These are voluntary reports because not every agency is set up, nor does every agency choose to share overdose reports with us, but we have 20,000 reports that have been shared by partners since the beginning. We have a special component of Save Lives Oregon where we have provided schools with the naloxone for schools. So over 665 schools have taken that up. That represents about 70% of school districts in the state. And that project, when we did an evaluation of it, we did find that the naloxone was used to respond to overdoses on school sites to both middle schools and high schools. And so we've expanded that program to include all schools and all grades throughout Oregon. We also have over 400 community agencies that receive harm reduction supplies. So this is a map that shows the number of agencies as of March 2025 who are participating in the Save Lives Oregon initiative. And so looking at those agencies by the type that they are, 57% are community organizations, 25% are what we call uniformed first responders. That's fire, EMS, police, and sheriff. Approximately 9% are substance use treatment programs, and the remaining, many of the remaining, I believe it's 9%, are what we call special districts. So special districts are specific types of government entities. They're usually very rural and they are very broad. So in that group, we have things like county libraries. We have several bus transit services that provide naloxone, ports, and very rural hospitals and clinics. So what we know from our annual survey, and I'll be talking about that in a few minutes, is that that the vast majority of the supplies that are distributed by Save Lives Oregon partner agencies includes naloxone. So 96% of the respondents to our annual survey last year reported that they distributed naloxone. The next two being equal were wound care supplies and personal hygiene supplies. And also 70% of partner agencies say Save Lives Oregon is their sole source for life-saving supplies. We anticipate that this is not going to necessarily be going down given the current funding environment. So I told you we were going to talk about our annual survey, so here we go. The annual survey that we do, I want to talk a little bit about it before I give you the results, and we can send you more information if you're interested. The survey was created by the Save Lives Oregon OHA and leadership team with the support of Tabor North Communications. The survey is digitally programmed and implemented using Smartsheet in both English and Spanish. So in terms of the timeline, last year we distributed the survey via email on December 17th. We did a follow-up reminder via email on December 30th, and then we closed the survey to respondents on January 8th. So the survey is open and open for a very short period of time and then has a window of close. And one of the reasons we do this is to gain insight. The survey helps Save Lives Oregon track progress, track sentiments, ask people what they are interested in learning about in the coming year. So we understand, we want to just know more about what people's experience are. We also work through the survey voluntarily, asking people if they'd be willing to share their stories about how their agency has partnered with Save Lives Oregon, and we feature those on our website. So the targeted response, going on to kind of where we sent it, it was sent out to 780 partner contacts from 375 agencies last year. This includes people who've ordered supplies, people who've attended learning collaboratives, and this was separate from our school survey. So no schools, universities, or school-based health centers, they had their own evaluation. We garnered 191 responses from 168 partner agencies. So this yields about 45% of partner agencies participating responded to the survey. So if you've done a survey, that's a decent response rate. And although, all the questions were optional, none were required. Some questions had logic built in. For example, if you attended a learning collaborative, you were asked questions about your experience. But if you didn't attend a learning collaborative or respond that you did, then you didn't see those questions. So here's what we learned last year. We learned that we had partners in the Save Lives Oregon respondents who were delivering supplies into every county in the state. Like I said, we started in 2020. Last year was the first year where we had Save Lives Oregon community partners who responded to this annual survey, distributing supplies in every county in the state. One of the things we asked was about culturally specific services, and what that meant is asking, did an agency provide culturally specific outreach, materials, or interventions? And did that agency that was doing that ensure that staff had capability to provide quality care for specific communities? So looking at that, we had approximately 34% of the respondents reported that they provided culturally specific care to American Indian or Alaska Native communities. About a third also responded that they provided culturally specific care to Black or African American communities, and 58% of partner respondents provided culturally specific care to Hispanic or Latin communities. About half of the respondents provided care to people who had been recently incarcerated or involved in the legal system, 68% for people who were unsheltered or housing insecure or living in conditions that made them vulnerable to environmental hazards, and about 55% reported that they provided care to LGBTQAI plus or gender minority people. This is one of the things, this is just a sampling of some of the responses that people said to the question of how Save Lives Oregon has impacted the work that they have been able to do. So I'm going to highlight just a few of these. From Coos County, one of the respondents wrote, preventing HIV, Hep C overdose, and providing an avenue to engage and connect. And then in Crook County, respondent wrote, as a small rural community with a very limited budget, these supplies are invaluable to our mission of protecting and educating our community. So I want to talk just briefly about our learning collaboratives. So 88% of respondents who reported attending a learning collaborative said that they learned something new that improved how they served their community. This is a kind of a pie chart. We wanted to see what that looked like as well. One of the topics we also asked in 2024 was, which topics would you like covered at learning collaboratives in the future? And this is the respondents by the number of how many identified a particular topic. And looking over this and our 2025 Learning Collaborative list, we provided learning collaboratives this year on substance use and overdose trends. We just did data collection methods and best practices, which was paired with measuring the impact of harm reduction strategies. We had a learning collaborative on harm reduction in rural communities. We've had learning collaboratives on building different types of harm reduction kits. Our most well-attended learning collaborative this year has been methamphetamine in Oregon. We also provide an all about naloxone, basics of harm reduction, and harm reduction in tribal communities. So these were all learning collaboratives that we provided this year. We are able to also provide learning collaboratives that have been identified as of interest in English and in Spanish. So one of the things we would like to do is to invite you all to consider joining us at our learning collaborative. If you are, I can't see people's faces from here, but if your agency, if you are interested, you are always invited to attend the learning collaborative. You do not have to be an agency that's distributing supplies, nor do you have to be an agency that's distributing supplies to access any of the materials that we have developed. So looking at materials, the vast majority of respondents said that they have distributed Save Lives Oregon tools or materials with supplies in the community. For example, giving fentanyl test strips with the instructions for fentanyl test strips or given naloxone with instructions for how to use that naloxone. We ask folks which materials and videos that they have used well, our top 5 are how to give naloxone. We have a short video that can be shared on your phone. You can share it on your site on how to give naloxone in English and Spanish. We have one-pagers on naloxone nasal spray. We also developed an Oregon Good Samaritan Law wallet card that folks can put in with their kits. Also, folks have used the All About Naloxone presentation that we put up on the website, and we have posters, Get Naloxone Here, etc. So looking at the tools that folks are using, they're really base materials that many types of agencies that are integrating harm reduction strategies into their work have used. So here is kind of a sample of what some of those materials look like and a link for more. Again, you can link and download those. This year, we are hoping to use some funding to print those out for agencies that don't have the ability to do printing on their own. And I wanted to end kind of with our fiscal stewardship. This is always a question that we are asked. Save Lives Oregon has received funding from the Opioid Settlement Prevention, Treatment, and Recovery Board, and those funds fund our clearing supplies only. They do not fund staff. Other elements of the Save Lives Oregon initiative are funded by the SAMHSA State Opioid Response Grant. We also have used behavioral health general funds and SAMHSA block grant funds. So it's substance use prevention, treatment, and recovery services. So thank you. And I really invite you to, if you're not distributing supplies and you're interested and work with people who use drugs and would like to distribute supplies, please consider checking out our website and applying to distribute. You are absolutely invited to learning collaboratives. We are getting ready to send out our annual survey. So if you are a partner agency, one of the things that's really important is if you tell us like how things are going. So that's what I have. Thank you.